Morning. It's Thursday, December 28th, and this year has been a kind of tough year for my wife. She had several TIAs and ended up in the hospital about 3 different times. Not for any long periods, a couple of days here and a couple of days there. And there was one stretch when she couldn't go to St. Catherine's and she had to go down to the South Shore to a different hospital. I can't remember the name right now. Good Samaritan. We had to go down to Good Samaritan. And she spent a week down there, and they were going to do something, but the doctor didn't want to do it. He didn't want to do it, and he wanted her to come back to Smithtown and spend a month here, and then he was going to take her back. In any event, we nixed that whole deal, and we stuck with St. Catherine, and St. Catherine's does a wonderful job. But the bill, I want to talk to you about the bills. The bills were astronomical, but we have a great insurance plan, and so we didn't have to pay much money. But the bills accounted for close to $500,000. And I only paid, I don't know, $5,000. So in any event, you gotta have good insurance. And I'm not talking about the hospitals now because of the quality of care, which was excellent. I have no problem with the quality of care except for that dumb doctor down at Good Samaritan. And I know that nurses and EMTs and people like that work very hard at their job because those EMTs that came to my house were excellent, and the police come with them. It's an experience that I don't wish on anybody, but I'm telling you that the people that come are terrific. And so why am I talking about this now? I'm talking about this because hospitals are now being sold. Private equity firms are taking over hospitals and nursing homes and other healthcare delivery systems now, and in the last couple of years they have been doing that. And because of this new trend, care is getting riskier for the patients. Although I didn't see any of that because I wasn't involved with a hospital that had been taken over by a private equity firm. So the researchers examined how often patients have experienced certain adverse outcomes at hospitals before they were bought by private equity firms and after. And they found that the rates of hospital-acquired complications for patients increased by 25% at hospitals after they were purchased. The study doesn't answer exactly how private equity ownership diminishes care, but one of its authors said the previous research shows these kinds of acquisitions are often linked to staff cuts and replacing doctors and nurses with lower paid employees. So do we want a healthcare system where the people who buy the hospitals are in it to make a profit? Is that the way we want to run our medical system? We have the highest priced medical care in the world, and now we're letting private equity firms get their hands on hospitals? That's a monumental shanda. It's a disgrace that this is allowed in this country. They should be qualified institutions that take care of hospitals. This should not be a piece of property like a home where you could sell it to anybody. There should be rules and regulations. There ought to be a criteria that makes a hospital run. You got to have X number of doctors, X number of nurses, X number of EMT. All of those things should be on the book. and they should be determined by the number of beds you have. So if you have 100 beds, you might need 1,000 people because you need 10 people for each bed or something like that. But to turn hospitals into the hands of money-making machines, is that what we've come to in this country? That's insane. Medical care in this country is so expensive. Do we have to increase the cost of medicine by selling it to private equity firms? And they probably have people who become the general manager in the hospital or something, don't know shit about medicine. This is a disgrace on top of all of the other high-priced situations in the medical care industry in this country. We're giving hospitals to money-making machines. That's not right. That's not right at all. But this is a scary situation, and I'm not making it up. Let me give you the facts. Accidental research has shown that private equity ownership is associated with higher death rates for patients in nursing homes and increased costs to the taxpayers. And then the Senate had a bipartisan committee to announce the results of this investigation. And the researchers analyzed the outcomes of nearly 5 million hospitalizations, which were available through Medicare claims data. And researchers had at least 3 years of data on each hospital included in the analysis. And many of these complications were designated as never events because they are preventable medical errors that should never occur during routine care, such as leaving a foreign object in the body after surgery, failing to correctly match a patient's blood type, falls, infections at certain kinds of surgical sites, or where doctors insert catheters or central lines, blood clots after joint replacement surgeries, and pressure sores. But it was done because there's been evidence that proved that the economics of this private equity hospital purchase had increased the billing rate. And there's little understanding by these new owners of how these changes impact patient care. Studies showed that the hospital rates by these private equity firms had increased for patients by 25%. So the experts who track the impact of private equity ownership in healthcare called the findings stunning with respect to the poorer quality of care given at these institutions and at the life-threatening situations that seem to occur more often in these private equity-owned institutions. The number may even be higher than what we expected, one of these leading researchers said. So if you have to go to the hospital, make sure that it's not owned by a private equity firm. Make sure that your life is not in danger because of the hospital ownership situation. And I say that to my audience because I believe most of you are at an age where hospitalization is something that may occur more often than it does in the general population. So beware of the private equity invasion in our hospital universe. And I leave you with that this morning. A terrible situation. Healthcare is expensive as it is, but it doesn't have to be made poor by the people who are now investing in hospitals. Have a great day.